Umbilical cord blood stem cells, they are used for all. What is that they are not used? What is except about it? Shoot your answer, doctor. Roger, Anjali, Monica, Alek. Yes. Shoot your answer. So I can see Rocket Trader thinks no to Parkinsonism. Murali thinks leukemia. So Roger, please give a call to the helpline. They will be more than happy to address the specific, if you have any issues, we'll be more than happy to help you out anytime. So I can see A versus D. Who said D? Kota, Konda, Divyashree, Jindabad, except osteoporosis. So umbilical cord blood stem cells, USC, is used for a lot of conditions like cirrhosis, cardiopathies, etc., etc. It is used for osteopetrosis, not osteoporosis, is what you have to be very, very sure about. A patient has ectopic pregnancy, has a beta HCG less than 6,000. Medical management was done with a single dose of methotrexate. Beta HCG repeated after 48 hours is 7,000. What do you want to do further in the management of this case of ectopic pregnancy treated with methotrexate is a very, very important decision which you have to take an answer. Oh, very good. Rituraj is, where are you, Rituraj? Rituraj is basking in a boat in Kerala on a honeymoon, I think. So, but able to participate in the class. That is the beauty, thanks to YouTube, guys, right? So, whether you are in boat or whether you are in a lap of your fiancé, still, if you are willful about winning the NEET PG exam, we will always be there with you like your best classmates. Yeah. Now, very good. I can see Gulam Bhatt, Alex Seth, everyone is saying yay, right? So let me check. Neha Srivastava, Jindabad. अब आजकल तो पूरा जिंदाबाद ही चल रहा है, political season है elections का, right? So who gets Jindabad? Let us see. You have to follow up with beta HCG after once more 72 hours is the protocol. So doctor, you have done diagnostic curettage. How do you approach a ectopic pregnancy? Villi present or villi absent is very important. If villi present, do serial quantitative beta HCG. If the beta HCG is found to be rising, then you need to search for a coexisting ectopic pregnancy. But if the beta HCG declines by at least 15%, that means to say it is an incomplete abortion. Then if the villi is absent, you continue serial beta HCG and perform transvaginal ultrasound. If the beta HCG is declining, you further follow up beta HCG. Beta HCG levels are rising or they have plateaued, then ectopic mass is less than 3.5 centimeters. Then medical management of the ectopic pregnancy is the treatment. And if the beta HCG levels are plateaued, but the ectopic pregnancy mass is more than 3.5 centimeters, then you need to perform a laparoscopy or a laparotomy for ectopic pregnancy. You have to be 100% sure on this protocol. You should be very often asked question in obstetrics. Gynecology obstetrics may simple questions like bacterial vaginosis, clue cells, everybody will answer. Those questions which involve a bit of clinical management and decisions, management algorithm, that is the place where those who prepared well can be able to answer. So I want you to be in the prepared well class. A 35-year-old married woman, no risk factor for cervical cancer. PAP is showing ASUS, atypical squamous cells of undetermined significance for the first time. So how do you want to clinically manage is a very, very important question. So basically you have to follow up on a PAP at around 6 months is considered to be the most important decision which you have to be very, very sure about. Question number 21. Ashima is absolutely right to consider PAP test after 6 months. So whenever the screening detects the atypical cells of squamous cell nature, you repeat the cytology and the HPV, mRNA and DNA, papilloma virus, mRNA and DNA, and test after 6 to 12 months. Then if it is normal, what do you want to do? If the cytology is still persistently positive, what do you want to do? I leave the literature for you. Atypical squamous cells of unknown significance is one of the favorite question by the examiner, because we are in this country of India where cervical cancer is very, very common, prevalent is what you need to remember. Now, for a primary amenorrhea individual having XY karyotype, normal infantile external and internal genital, fibrous bands in the gonad, no sexual characters, what is the most probable diagnosis? Question number 22. I want all of you to answer this correctly. Already we have discussed it in our PGI question bank about this particular question. Question number 22. Monica Jindabad, Sunita clean bold. I know. Pulkit Gangwal is also clean bold. Very good. XY karyotype made you to get attracted and seduced by the testicular feminization syndrome, right? I know it. But where is the breast development? There is no breast development. If there is a breast development, then you have to think of testicular feminization syndrome. So what is gonadal dysgenesis, otherwise called Swyer syndrome, 46XY? They have the Y chromosome, but there are mutations in SRY gene. And because of that, testis doesn't form. Anti-Mullerian hormone and testosterone are not produced. So that is the reason a normal uterus and fallopian tubes, female external genitalia are the ones which typically develop. And there is elevated FSH, LH and streaky gonads. So that is called the gonadal dysgenesis 46XY, just like testicular feminization syndrome. But still, they don't have that feminine characteristic features is what you have to basically remember. Very good. Bahubali is saying, sir, we love your teaching style, sir. We have only that style, right? Rajnikant only know how to turn the cigarette and get it onto between his two lips. We also love your answering style. So, just at the spot, some of the students can guess the correct answer. I love such students. Honestly speaking, you need not read everything. You should also carry a good capability to uncanny sense to hit the MCQ. That also, that's the reason, continue to guess the correct answers and develop your own style. That's very important. Yeah. Now, a lady using OCPs has a complaint of vaginal discharge and pruritus vulvae. There's a curdy white discharge from the vagina. What is your clinical diagnosis? Question number 23. Snowber Vani, everyone says B. Sunita says A. Obviously, monilial vaginitis is very common in this given. Curdy, curd hote hi, aap sochna hai, kali, candidiasis. Anti-sperm antibodies are usually present in the cervix, is what you have to remember. Yes, this is a beautiful question. Shoot me, what is your answer, doctor? Question for sale. A woman is operated for chocolate cyst. She has a normal menstrual cycle. What are all the things used for the treatment of it? So first of all, what is chocolate cyst? Underlying cause, you should be very sure. Except what? Very good. Monica, Dawn, they are all thinking tranexamic acid. Murali thinks A. Divya thinks B. Absolutely. Why do you use tranexamic acid for endometriosis? It does lead to bleeding, but bleeding should, underlying cause should be stopped. So, how do you manage endometriosis is very important. Suppose if it is a mild, moderate or a severe endometriosis and there is a pelvic pain, then you treat it with Mirena, oral progestins, gonadotropin releasing hormone agonists and combined oral contraceptive pills. And surgically you will do the ablation. If it is mild, moderate endometriosis and infertility is the issue, surgery becomes the preferable choice of excision and ablation, and you do ovarian stimulation and intrauterine insemination. If it is a severe endometriosis and severe pain, both medicine and surgery, and severe endometriosis and infertility, then surgery or IVF is considered to be the management of choice, is what you need to remember. This is one table, one slide. You have to bookmark and set up a reminder in the UMedico app, in the notes feature. NSAIDs, combined OCPs, progestin only pills, androgens, GnRH agonists and aromatase inhibitors. These are the ones which are used. Endometrium gets encouraged by estrogen and discouraged by the progestins. So that is the reason the ectopic endometrial implants need to be discouraged by administration of progestin only preparations and antagonize the estrogen, which is the underlying principle of management of endometriosis, is what you need to remember.